Welcome. This will be a performance assessment and development presentation, assignment number 3 for EDU607, Assessing and Managing Learning. My name is Matthew Hess. I am a graduate student at Post University. This presentation will cover the importance of performance assessments. We'll then review the Terminal EMS Education Standard as outlined by the United States Department of Transportation. We'll talk about the course's performance task, explain student-friendly template as applied to the standard and performance task, and review the rubric that will be given to the learner and the evaluator for this performance task. Performance assessments require learners to perform a skill and have certain criteria for which the task will be scored. In the context of EMS initial education, this design applies to skill validation tests, where students are required to show competency in skills after they have learned them, including peripheral IV access or medication administration. Additionally, this design is utilized in formative testing as students complete a patient scenario or simulation. This performance is graded using the rubric that will be explained. This rubric has mandatory actions and critical fail criteria as part of the rubric. This rubric will have subjective and objective components, which will be explained in that section. The United States Department of Transportation oversees emergency medical service education curriculum standards. National community stakeholders provide data and subject matter experts drive curriculum development and compliance. These stakeholders included the National Registry of Emergency Medical Technicians, the State Department of Public Health, and the Commission on Accreditation of Emergency Medical Service Providers. This curriculum identifies the following standard as a terminal objective for initial EMS education. Graduates of the paramedic program will demonstrate the ability to comprehend, apply, and evaluate the clinical information relative to his or her role as an entry-level paramedic, demonstrate technical proficiency in all skills necessary to fulfill the role as an entry-level paramedic, and demonstrate personal behaviors consistent with professional and employer expectations for entry-level paramedic providers. Knowledge targets represent factual components relating to each discipline. It highlights what students need to know outright in relation to the foundational concepts to which they have studied. The knowledge learning target for this standard is to demonstrate the ability to comprehend, apply, and evaluate clinical information relative to his or her role as an entry-level paramedic. Examples of this target include confirmation of clinical knowledge as it relates to anatomy and physiology, pharmacology, pathology, and airway management. Reasoning targets highlight what students need to solve using critical thinking and reasoning skills. For this standard, students will demonstrate the ability to apply and evaluate the clinical information relative to his or her role as an entry-level paramedic. Examples of this learning target include the formation of a primary impression relating to a simulated patient's signs or symptoms. Skill targets refer to when students use their knowledge and reasoning to act skillfully and through their performance demonstrate their decision-making ability through observation of an educator or evaluator. For this standard, students must demonstrate their ability to treat the patient using the skills within their scope of practice and based on their primary impression that formulate through the reasoning target. Product targets utilizing this knowledge, reasoning, and skill will create our final product. For this standard, learners demonstrate technical proficiency in all skills necessary to fulfill his role or her role as an entry-level paramedic and demonstrate the appropriate professional behavior consistent with an emergency medical technician at the paramedic level. This product will be observed in a summative simulation of a patient who will be suffering a medical emergency. The rubric applied to this presentation will be for an asthmatic patient and will be explained in that section. Students should understand the learning target as it increases their probability of success and facilitates overall learning. When students understand a lesson learning target, the performance that will be demonstrated in their understanding and the criteria for which their work will be addressed improves their ability to self-regulate and progress towards the terminal goal and reduce unsuccessful efforts. To accomplish this with the stated standard, the targets are explained using student-friendly language, typically associated with I can statements. However, in the context of educational EMS education, language should remain as consistent as possible with national standards to maintain a level of consistency across this large target area. You can see several examples of I can statements applied to the standard outlined previously. I can comprehend, apply, and evaluate the clinical information relative to his or her role as an entry-level paramedic. I can apply the clinical knowledge relative to the patient presentation. I can evaluate the clinical information relative to the patient. I can be proficient in all physical skills and maintain a consistent professional demeanor. I can function as a pre-hospital ALS provider and direct the action of an emergency response team in assessing and treating an array of emergency medical conditions. There are several types of rubrics to evaluate a student's competency in a particular area. In the context of a terminal EMS education performance task, a hybrid rubric will be applied and explained in the subsequent slide. Hybrid rubrics utilize features of general and task-specific rubrics with the goal of observing the overall judgment of the final product quality, evaluating the individual's characteristics and performance, and assessing a specific task. For this rubric, points are awarded based on each assessment item, and there is a minimum action and minimum requirement for the patient presentation. In this example, will be an asthmatic patient who is having an acute onset of shortness of breath. In this snippet of the rubric itself, which consists of 5 pages in total, you can see that the template that is provided to the learner at the beginning of the course has step-by-step assessment findings that they will learn to apply in a systematic manner. When certain criteria does not pertain to the patient presentation, they are grayed out and not counted in the total available points to the learner. At the end of the rubric, as seen in the middle picture here, are the minimum requirements and mandatory actions as applied to the patient presentation. And on the last page, there's also a spot for the evaluator to write subjective feedback based on the learner's professional demeanor as it applies to the patient, the evaluator, and their peers in the simulated environment. While the student may get all the required points in the skills portion of the assessment, failure to complete the mandatory actions will result in a critical fail for the assignment or evaluation, as they are not demonstrating terminal competency and do not have the ability to critically think, formulate their primary impression, or a treatment plan as it applies to the information obtained. This rubric can be applied to different patient presentations with the same concept of graying out the area not applied to the patient as it's presenting the simulation, or in the case of assessing at a baseline for a medical assessment, all areas can be left in play for points to be awarded with no mandatory actions other than completing the assessment in a step-by-step systematic manner. In the self-critique of this assignment, I gave the rating score 5 in all of the key indicators for this assignment. In key number 1, the assessment, serving a clear and appropriate purpose. I believe that the assessment identifies the learner as the subject of the information. The hybrid assessment tool supports student learning through evaluating of psychomotor skills and evaluating systematic medical approach to a patient complaint or problem with a minimum requirement of a mandatory action or failure to complete that mandatory action. In key number 2, again rating number 5, this assesses for the reflect of the valued achievement target. Again, the learner must target clearly separated domains of knowledge, reasoning, and skill. The learner achievement will be evaluated in task-specific proficiency and overall summative assessment ability, critical thinking, and leadership ability. The learning target is focused on summative and terminal focus of the instruction, to which the learner must demonstrate they are workforce ready and a competent ALS provider. In key number 3, the design, I believe the assessment methods match the learning target. The sample provided represents a detailed rubric of a specific task that compromises a complete assessment. The assessment in and of itself is designed to limit bias. Either the student did or did not complete the action. However, the evaluator is asked to judge the learner and his or her level of professionals and empathetic care. The evaluator can write this subjective feedback in the space provided on the last page of the rubric. This feedback can be reviewed by other EMS professionals or educators, and the simulation is recorded for review of these other evaluators. Key 4, communication. I do believe this assessment results can be used as a guide for instruction, as when the assessment is complete, a debrief is allowed between the evaluator and the learner. The learner can self-reflect on their performance and what they could do better given the chance to do the simulation again. The learner is then provided an opportunity to write a reflection piece as part of the documentation for the scenario, and this self-reflection is shared with the learner as well. Lastly, key 5, student involvement. This assessment practice meets the learner's needs. Self-assessments are provided to the learner in the form of peer-to-peer assessments. Learners are provided an opportunity to debrief with their lab group and discuss performance. Additionally, students are allowed to use the same assessment tool to evaluate one another in peer-to-peer simulation review scenarios. In conclusion, I believe this performance assessment co-aligns with the terminal competency standard of EMS providers at the national level. The hybrid rubric allows for assessment of physical skills, critical thinking, reasoning, and performance tasks to be assessed, and ultimately the performance tasks allow for objective assessment and feedback relating to the learner's ability to enter the workforce as an entry-level provider. Thank you for watching. If you have any questions, feel free to leave a comment below or email the content creator. Thank you.